Free CNA Basic Nursing Skills Practice Test. Question 1. What are the recommended steps for proper hand washing according to the Centers for Disease Control and Prevention, CDC? Wet hands, apply soap scrub for 5 seconds, rinse and air dry. Wet hands, apply soap scrub for at least 20 seconds, rinse and dry with a clean towel. Apply soap scrub without water, use a sanitizer and dry with a towel. Scrub hands with sanitizer, rinse with water and dry. The CDC recommends scrubbing with soap for at least 20 seconds to effectively remove pathogens from the skin surface. Question 2. How do isolation precautions impact the psychological well-being of patients, and how can CNAs help mitigate these effects? Isolation precautions have no impact on psychological well-being. They can lead to feelings of loneliness and anxiety, and CNAs can help by minimizing interaction to reduce stress. They can lead to feelings of loneliness and anxiety, and CNAs can help by providing regular emotional support and maintaining open communication. They improve psychological well-being by providing patients with more personal space. Patients in isolation often suffer from sensory deprivation and loneliness. Frequent emotional support from the CNA is vital for their mental health. Question 3. Explain the importance of proper PPE selection based on the type of patient care activity. All PPE offers the same level of protection for any care activity. Proper PPE selection is only necessary for surgical procedures. Proper PPE selection is important to ensure the safety of the patient but not the healthcare worker. Proper PPE selection is crucial to provide appropriate protection against specific pathogens or hazards encountered in different patient care activities. PPE must be tailored to the specific risk of the task, e.g., masks for splashes versus gowns for contact, to ensure maximum safety for the caregiver. Question 4. Identify the types of items that must be disposed of in a sharps container after use in patient care. Gloves and gowns, needles, syringes, and lancets, paper towels and bandages, medication bottles and 4 bags. Any item capable of puncturing or cutting the skin that has been used in care must be disposed of in a puncture-resistant sharps container. Question 5. Describe the types of linen that should be disposed of in a biohazard bag rather than being sent to laundry. Linen that is lightly soiled with non-infectious substances. All bed sheets regardless of contamination. Linen that is heavily soiled with blood or bodily fluids and is deemed unsalvageable or poses a risk of infection. Linen used in the dining area. Biohazard bags are used for linen so saturated with infectious material that it poses a high risk during transport or is likely to leak through standard laundry bags. Question 6. What is the most common type of accident for clients in healthcare settings? Medication errors, falls, burns, equipment-related injuries. Falls are the leading cause of accidental injury in healthcare facilities, particularly among the elderly and those with mobility issues. Question 7. What steps should CNAs take to ensure the safety of clients during a severe weather warning? Wait for the weather to improve before taking any actions. Follow the facility's emergency plan, ensuring clients are moved to safe areas and have access to emergency kits. Advise clients to watch the news for weather updates. Encourage clients to go outside and assess the weather conditions themselves. Following the established facility protocol ensures a coordinated and safe response for all residents during environmental emergencies. Question 8. What initial steps should a CNA take upon hearing an active shooter alert in their healthcare facility? Immediately leave the building regardless of client's conditions. Seek immediate shelter, locking or barricading doors if possible, and ensuring silence in their area. Continue with their tasks until more information is available. Search for the shooter to understand the situation better. The Run Hide Fight protocol suggests that if you cannot safely evacuate, you must secure your location and stay silent until the threat is clear. Question 9. What is the importance of understanding a client's code status for a CNA? To determine the client's dietary preferences. To understand the client's personal background. To ensure appropriate emergency response actions are taken. To know the client's room number. Code status, such as DNR or full code, informs the staff whether or not to perform life-saving measures like CPR during a cardiac arrest. Question 10. What immediate action should a CNA take to ensure clients' safety during a sudden power outage? Leave clients alone and find a light source. Ensure all clients are accounted for and safe, then assist in implementing the facility's emergency plan. Immediately start evacuating clients from the building. Continue with routine care as if the power outage did not happen. Accountability of all patients is the first priority during a utility failure to ensure no one is trapped or in distress without monitoring. Question 11. How can a CNA identify the signs of a client who is choking? The client is speaking clearly and calmly. The client is coughing lightly and can breathe easily. The client is unable to talk, breathe, or is making high-pitched noises. The client requests something to drink. Total airway obstruction prevents speech and normal breathing and is often accompanied by the universal choking sign, clutching the throat. Question 12. What does CPR stand for and what is its primary purpose in emergency care? Cardiopulmonary response, to restore breathing. Cardiac pulmonary resuscitation, to treat heart attacks. Cardiopulmonary resuscitation, to restore normal heart rhythm. Cardiopulmonary resuscitation, to maintain brain function until further measures. CPR provides manual circulation and oxygenation to keep the brain and vital organs alive until advanced medical intervention can be applied. Question 13. What are the first steps a CNA should take when preparing to make an occupied bed? Place the bed in the lowest position. Collect all necessary supplies. Explain the procedure to the client. All of the above. Proper preparation involves gathering equipment, informing the resident, and setting the environment for safety and efficiency. Question 14. What strategies can a CNA use to dress a patient with one-sided weakness effectively? Dress the stronger side first. Dress the weaker side first. Use tight-fitting clothes. Avoid talking to the patient to maintain focus. When dressing a patient with weakness, always dress the affected, weak, side first and undress it last to minimize limb manipulation. Question 15. What are the guidelines for deciding when to use restraints on a patient? When the patient requests them for comfort, as a convenience for the staff. When less restrictive measures have failed and the patient is a danger to themselves or others, based on family requests. Restraints are a last resort used only for safety and must be supported by a physician's order after other de-escalation methods have failed. Question 16. How does a CNA correctly identify the axillary area for temperature measurement? By finding the upper arm area. By locating the center of the forehead. By identifying the area under the patient's arm. By locating the patient's wrist. The axillary temperature is taken in the armpit, which is the medical term for the axilla. Question 17. What are considered abnormal readings for an adult's temperature, pulse, respiration, and blood pressure? Temperature 99.5 degree F or 100 BPM or 20 breaths/min or 140/90 mmHg or 90/60ths mmHg. Temperature 101 degree F or 90 BPM or 16 breaths/min or 130/80 mmHg or 100/70 mmHg. Temperature 100 degree F or 80 BPM or 18 breaths/min or 120/80 mmHg or 110/70 mmHg. All of the above. These values represent deviations from the standard adult healthy resting ranges and should be reported to the nurse immediately. Question 18. What supplies does a CNA need to gather before giving a bed bath? Gloves and a pillow. Basin, warm water, soap, gloves, washcloth, towel, bedpan and urinal. Blood pressure cuff and stethoscope. Standard bed bath supplies ensure hygiene and warmth while protecting the caregiver from bodily fluids with gloves. Question 19. How does a CNA ensure the patient is comfortable and safe throughout the bed bath process? By rushing to complete the bath quickly. By using cold water to refresh the patient. By maintaining the patient's privacy and using a gentle touch. By leaving the patient alone briefly to ensure privacy. Maintaining dignity through privacy and preventing skin injury with a gentle touch are core components of compassionate patient care. Question 20. What are the key steps for ensuring proper care of an indwelling catheter? Regular handwashing and wearing gloves. Keeping the drainage bag below the level of the bladder. Checking for kinks in the tubing regularly. All of the above. Catheter care focuses on preventing infection, CAUTI, by maintaining a closed system, ensuring gravity drainage, and keeping the area clean. Question 21. How should a CNA position a patient before beginning to feed them? Lying flat on their back, sitting upright at a 90-degree angle, in a semi-reclined position on their side, leaning forward at a 45-degree angle. Sitting upright, high Fowler's position, is essential to facilitate swallowing and prevent life-threatening aspiration. Question 22. What is the primary purpose of anti-embolism stockings for patients? To keep the feet warm, to reduce the risk of deep vein thrombosis, DVT, to improve mobility, to absorb sweat and keep feet dry. Anti-embolism stockings, TED-hose, apply graduated compression to the legs to improve blood return to the heart and prevent blood clots. Question 23. What are the steps a CNA should follow when taking an oral temperature? Place the thermometer under the patient's armpit. Clean the thermometer, then immediately place it in the patient's mouth. Explain the procedure to the patient, ensure the thermometer is clean, place it under the patient's tongue, and ask the patient to close their mouth. Insert the thermometer into the patient's ear. Accurate oral temperature requires the probe to be placed in the sublingual pocket under the tongue with the mouth closed. Question 24. What are the precautions a CNA must take when measuring a rectal temperature? Use the same thermometer for oral and rectal readings without cleaning. Ensure the patient is in a comfortable position and explain the procedure. Insert the thermometer at least 4 inches to ensure accuracy. Avoid using lubrication to increase the patient's comfort. Because rectal temperature is invasive, the CNA must prioritize communication positioning, SIMS position, and patient comfort. Question 25. How does a CNA correctly locate the pulse points on a patient for pulse measurement? By feeling for the softest point on the wrist. By looking for visual signs of the pulse on the skin. By pressing down on the wrist using the tips of their first 2 or 3 fingers. By using a stethoscope anywhere on the arm. The radial pulse is measured by placing the fingertips over the radial artery on the thumb side of the wrist. Question 26. What are the steps to correctly measure a patient's blood pressure using a sphygmomanometer? Inflate the cuff, place the stethoscope, read the dial immediately. Place the cuff, listen for heart sounds, then inflate the cuff until the gauge reads 200 mmHg. Place the cuff, inflate the cuff, listen for heart sounds with a stethoscope, slowly release the air, and read the systolic and diastolic pressures. Inflate the cuff to 100 mmHg, deflate immediately and ask the patient for their usual blood pressure range. Correct blood pressure measurement involves listening for the Korokov sounds, systolic and diastolic, as the pressure is slowly released from the cuff. Question 27. How should a CNA count a patient's respiration rate? By estimating based on the patient's activity level. By counting the number of breaths for 30 seconds and multiplying by 2. By counting the number of breaths for 15 seconds and multiplying by 4. By counting the number of breaths for a full minute. Counting for a full minute is the most accurate way to assess the rate, rhythm, and depth of a patient's breathing. Question 28. What does a systolic blood pressure reading represent? The pressure in the arteries when the heart is at rest. The pressure in the arteries when the heart beats. The total volume of blood in the body. The resistance to blood flow in the blood vessels. Systolic pressure measures the maximum force exerted by the blood against the arterial walls when the heart contracts. Question 29. What does a diastolic blood pressure reading indicate about a patient's health? The pressure in the arteries when the heart is at rest between beats. The pressure in the arteries when the heart contracts. The amount of oxygen in the blood. The volume of blood the heart pumps. Diastolic pressure measures the constant pressure in the arteries when the heart is in the relaxation phase between beats. Question 30. How should a CNA assess a patient's pain level? Guess based on the patient's condition. Use a standardized pain scale. Only ask the patient's family. Assess once and never reassess. Pain is subjective. Using a scale, like 0 to 10 or FACES, allows for objective documentation and consistent monitoring of a patient's comfort. Question 31. How does a CNA accurately measure and record a patient's fluid intake? Guessing the amount of fluid intake. Measuring only the fluid the patient drinks. Using a standard measuring tool for all fluids ingested by the patient. Asking the patient to keep track of their own fluid intake. Accurate intake charting requires measuring all liquids, including ice cream or gelatin, using containers with known volume markings in ml. Question 32. What is the normal pulse rate range for adults? 50 to 70 beats per minute, 60 to 100 beats per minute, 70 to 110 beats per minute, 80 to 120 beats per minute. The normal resting heart rate for a healthy adult is typically between 60 and 100 beats per minute. Question 33. What is the normal pulse rate range for children? 60 to 100 beats per minute, 70 to 120 beats per minute, 80 to 130 beats per minute, 90 to 110 beats per minute. Children have higher metabolic rates and smaller hearts, resulting in a naturally faster resting pulse rate than adults. Question 34. What is the conversion factor from ounces to milliliters, ml? 1 ounce equals 100 ml, 1 ounce equals 50 ml, 1 ounce equals 30 ml, 1 ounce equals 10 ml. In medical intake and output recording, the standard conversion used is 30 ml for every 1 fluid ounce. Question 35. Explain the significance of hand washing in breaking the chain of infection in healthcare settings. It's a quick way for healthcare workers to clean their hands. It removes visible dirt only. It prevents the spread of infections by removing germs from hands. It is only necessary after touching a patient. Hand washing is the primary defense in healthcare to remove transient microorganisms and prevent cross-contamination between patients. Question 36. What specific measures should be taken when providing direct care to a patient under contact precautions? Use of gloves and gowns for all patient interactions. No special measures are needed for contact precautions. Only hand hygiene is required before and after patient contact. Use of an N95 respirator at all times. Contact precautions require physical barriers, gloves and gowns, to prevent the transfer of pathogens that live on the patient or in their environment. Question 37. Describe the steps for correctly donning PPE before entering a patient's room. Gloves, gown, mask and eye protection in any order. Gown, mask, goggles or face shield, and gloves in that order. Mask only as it provides sufficient protection. Gloves first, then any other PPE as available. Following a specific donning sequence ensures that all areas are covered and the risk of self-contamination is minimized. Question 38. Explain why broken glassware that may have been contaminated with infectious agents should be placed in a sharps container. It is recyclable. To reduce environmental pollution. Because it can cause injuries and may be contaminated, posing a risk of infection. Glassware is easier to dispose of in sharps containers than in regular trash. Broken glass acts as a sharp that can cause percutaneous injury and transmit bloodborne pathogens, so it must go into a puncture-proof container. Question 39. How should CNAs handle linen that is heavily soiled with blood or bodily fluids to prevent the spread of infection? Shake the linen vigorously to remove solid particles before laundering. Rinse the linen in the patient's room before sending it to laundry. Carry the linen by hand to the laundry department without any protective bag. Wear appropriate PPE. Handle the linen as little as possible, and place it directly into a designated leak-proof bag or container for soiled linen. Minimizing the agitation of soiled linen prevents the aerosolization of germs, while leak-proof bags prevent environmental contamination. Question 40. How can falls particularly affect older clients? They primarily cause minor bruises. Falls do not significantly impact older clients differently than younger clients. They can lead to serious injuries, prolonged hospitalization, and decreased independence. Older clients are less likely to fall than younger clients. Due to conditions like osteoporosis, falls in the elderly frequently result in hip fractures or head injuries, which often lead to a permanent loss of mobility. Question 41. Describe the preparations CNAs should make for clients with mobility issues during inclement weather. Ensure that their mobility devices are stored safely away from them. Provide extra support and assistance, ensuring they can move to safe areas quickly and have access to their mobility aids. Leave clients with mobility issues in their rooms to keep hallways clear. Instruct clients with mobility issues to manage independently to build resilience. Patients with limited mobility require prioritized assistance during emergencies to ensure they reach safety at the same time as more mobile residents. Question 42. Describe the run-hide-fight strategy in the context of an active shooter event for a CNA working in a healthcare setting. Run to evacuate the facility if there is a safe path, hide if evacuation is not possible, and fight only as a last resort. Run around to find the shooter, hide clients in various locations, and fight the shooter with medical equipment. Hide immediately without attempting to run or fight. Fight the shooter as a first option to neutralize the threat. This is the standard safety protocol: evacuate if possible, hide in a secure location if not, and only engage the threat if your life is in immediate danger. Question 43. How can CNAs ensure they are informed about each client's current code status? Checking the client's medical chart regularly. Asking the client directly. Guessing based on the client's condition. Waiting for the client to inform them. The medical chart is the only reliable and legal source for a patient's current physician orders regarding emergency resuscitation. Question 44. How can CNAs help to maintain essential medical equipment functionality during a power outage? Disconnect all medical equipment to save battery life. Use personal cell phones as a power source for medical equipment. Assist in connecting critical devices to backup power sources like generators or battery backups. Ignore the equipment as the power will likely return soon. Identifying which outlets are connected to emergency power, usually red outlets, is a vital CNA skill to maintain life-saving equipment like ventilators. Question 45. What immediate steps should a CNA take upon recognizing that a client is showing signs of choking? Ask the client to drink water. Begin immediate abdominal thrusts, Heimlich maneuver. Encourage the client to cough if they can still breathe. Leave the client to find help. If the patient is coughing, they are still moving some air, the safest action is to encourage them to clear the obstruction themselves before performing thrusts. Question 46. Name the two fundamental techniques combined in the CPR procedure for adults: chest compressions and rescue breaths, arm lifts and back pats, leg raises and abdominal thrusts, finger sweeps and ventilation. CPR involves a cycle of high-quality chest compressions to move blood and rescue breaths to provide oxygen to the lungs. Question 47. How can a CNA ensure the client's comfort and safety while making an occupied bed? Changing the bed linens as quickly as possible. Keeping the client covered and checking for any signs of distress. Using a mechanical lift for all clients. Only adjusting the bed height once during the procedure. Safety and comfort are maintained by communicating with the resident and ensuring they are never exposed or in a position where they might fall. Question 48. How should a CNA approach dressing a patient with left-sided weakness differently from right-sided weakness? Start with the left side for both conditions. Use adaptive clothing for left-sided weakness only. Start with dressing the weaker side in both cases. Dress the stronger side first for both conditions. The rule for dressing a patient with any one-sided weakness is to always place the garment on the weak side first. Question 49. Describe the correct technique for tying restraints to ensure patient safety. Tightly to prevent any movement. With knots directly against the patient's skin. Using quick-release knots attached to the movable part of the bed frame. securing restraints to the stationary part of the bed. Quick release knots, half bow, allow for rapid removal in emergencies while attaching to the frame prevents injury when the bed position is adjusted. Question 50. What are the steps for taking an axillary temperature accurately? Place the thermometer in the patient's mouth, wait for the beep, then read the temperature. Clean the thermometer, place it under the patient's arm, ensure good contact with skin and wait for the reading. Insert the thermometer rectally, wait a few seconds, then check the temperature. Place the thermometer on the patient's forehead, wait until it beeps and then read the temperature. Axillary readings require direct skin contact in the center of the armpit with the arm held tight against the body to capture heat. Question 51. How should a CNA respond upon detecting abnormal vital signs in a patient? Immediately administer medications to normalize the vital signs. Report the findings to a nurse or healthcare provider immediately. Wait for an hour and recheck the vital signs before reporting. Record the findings and report at the end of the shift. CNAs must act as the eyes and ears of the nurse. Reporting abnormalities immediately allows for rapid clinical intervention. Question 52. How should the water temperature be tested before starting a bed bath? By touching the water with the back of the hand. By tasting the water. By measuring with a thermometer. By looking at the water. The back of the hand or inner wrist is more sensitive to temperature and helps ensure the water is safe, about 105 degrees Fahrenheit, for the patient's delicate skin. Question 53. What technique should be used to wash sensitive areas during a bed bath? Scrubbing vigorously to ensure cleanliness. Using a strong antiseptic soap. Wiping from front to back. Ignoring these areas to avoid embarrassment. Wiping from the cleanest area to the dirtiest, front to back, is essential to prevent introducing fecal bacteria into the urinary tract. Question 54. How can a CNA prevent infections associated with indwelling catheters? Changing the catheter daily. Using sterile techniques when touching the catheter. Applying antiseptic cream around the catheter site. Limiting fluid intake to reduce urine production. Preventing infection requires maintaining a clean closed system and using proper hand hygiene whenever the catheter or drainage bag is handled. Question 55. What are the signs that a patient may be having difficulty swallowing during feeding, coughing or choking during meals, asking for seconds, eating quickly, preferring cold food over hot food? Coughing during or immediately after a swallow is a hallmark sign of dysphagia and indicates a high risk for aspiration pneumonia. Question 56. How does a CNA correctly measure a patient for anti-embolism stockings? By measuring the length of the foot only. By measuring the widest part of the thigh. By measuring the length of the leg from the thigh to the ankle and the circumference of the calf and thigh. By guessing the size based on the patient's height. Proper fit is critical for TED hose to work. Accurate measurements of leg length and girth ensure the compression is therapeutic and not harmful. Question 57. How long should the thermometer remain in the patient's mouth to ensure an accurate reading? 10 seconds, 30 seconds, at least 1 minute, 3 minutes. Most oral thermometers require at least 1 minute, or until the electronic beep, to reach equilibrium with the patient's internal body temperature. Question 58. How is a rectal temperature reading different from an oral temperature reading? Rectal readings are usually lower than oral readings. Rectal readings are generally considered more accurate and slightly higher than oral readings. There is no difference in temperature readings between the two methods. Oral readings are more invasive than rectal readings. Rectal temperatures are closest to the body's true core temperature and are typically about 1 degree higher than oral readings. Question 59. What should a CNA do if they detect an irregular pulse while taking a measurement? Stop measuring and move to another task. Report the irregularity to a nurse or supervising healthcare provider immediately. Ignore it as long as the patient seems comfortable. Increase the pressure on the pulse point to regularize the pulse. An irregular pulse, arrhythmia, can indicate a serious underlying heart condition and must be reported for a full nursing assessment. Question 60. How does body position affect blood pressure readings? Body position has no effect on blood pressure readings. Blood pressure readings are higher when the patient is standing. Blood pressure readings can vary with changes in body position. They may be different when lying, sitting, or standing. Blood pressure readings are always lower when the patient is sitting. Gravity and heart level relative to the arm significantly impact blood pressure, which is why standardizing position, usually sitting, is important. Question 61. What are the characteristics of normal versus abnormal respirations a CNA should note? Color, temperature and humidity, rate, rhythm and depth, noise, smell and duration, frequency, taste and intensity. Respiration is assessed based on how many breaths occur per minute, rate, how steady the pattern is, rhythm, and how much air is moved, depth. Question 62. How can a CNA identify if a systolic reading is abnormally high or low? By checking if the reading is above 120 mmHg or below 80 mmHg, by ensuring the reading matches the patient's age, by comparing the reading to the average blood pressure for adults, by checking if the reading falls outside the normal range of 90 to 120 mmHg for systolic pressure. For a resting adult, a systolic reading significantly below 90, hypotension, or above 120, prehypertension/hypertension, should be noted. Question 63. What are the implications of a low diastolic reading? It indicates high cardiovascular fitness. It suggests potential for heart disease or stroke. It signifies an increased risk of dehydration. It can indicate poor blood flow and insufficient oxygen to the heart. Low diastolic pressure means the blood is not exerting enough pressure against arterial walls during the heart's rest phase, which can reduce oxygen delivery. Question 64. What are the nonverbal signs of pain a CNA should be aware of in non-communicative patients? Smiling and relaxation, constant talking and laughter, grimacing, moaning, or restlessness, increased socialization. In patients with dementia or those who cannot speak, behavioral cues like facial tension, moaning, or agitation are the primary indicators of pain. Question 65. What methods can a CNA use to measure a patient's output accurately? Estimating the amount visually, measuring only urine output, ignoring insensible losses such as sweating, using a graduated container to measure all liquid output. Accurate output recording requires using a hat or graduated cylinder to measure all urine emesis and liquid stool in ml. Question 66. How does activity level affect an adult's pulse rate? Increases pulse rate, decreases pulse rate, has no effect on pulse rate, initially increases then decreases pulse rate. Physical activity increases the body's demand for oxygen, which causes the heart to beat faster to circulate more blood. Question 67. How does age affect the normal pulse rate in children? The pulse rate decreases as children grow older. The pulse rate increases as children grow older. Age has no effect on the pulse rate. The pulse rate is constant from birth to adulthood. As children grow, their heart muscle becomes stronger and more efficient, resulting in a naturally slower resting pulse rate compared to infants. Question 68. Why is accurate conversion between ounces and ml important in healthcare? Ensures that medications are given in a fun way. Helps in decorating the patient's room. Ensures accurate medication dosages and fluid intake/output measurement. Makes the paperwork look more complicated. Precise measurement is vital for patients with heart or kidney conditions who must have their fluid balance monitored to prevent fluid overload. Question 69. How long should the hand washing process last to effectively remove germs? 5 seconds. At least 20 seconds. 1 minute. 10 seconds. The mechanical action of scrubbing with soap for at least 20 seconds is necessary to physically break down and wash away microorganisms. Question 70. How should CNAs apply droplet precautions differently than airborne precautions when caring for patients? Both require the use of an N95 respirator at all times. Only gloves are required for both droplet and airborne precautions. No mask is needed for droplet precautions, only for airborne precautions. Droplet precautions require the use of a surgical mask, whereas airborne precautions require the use of an N95 respirator. Airborne particles are smaller and travel further, requiring a special N95 respirator, while droplets are larger and heavier, requiring a standard surgical mask.